Right. Welcome to this edition of the Native News Update on this Thursday, January 7th. I'm your host for today's program, Paul DeMain. Many of the stories read here can also be found at our website at IndianCountryNews.com. Here are the news stories for the day from the Associated Press and other Native news sources. Ronnie Washneys, president of the Native American Journalists Association, has responded to Republican National Committee Chairman Michael Steele's language use regarding Native Americans during a Fox News event where he said, "Our platform is one of the best political documents that's been written in the last 25 years. Honest Injun on that." Washington says, "I'm thoroughly outraged that the leader of the National Republican Party would use such repulsive language on national television. Those of us in journalism have tirelessly worked to ensure that political leaders, newsrooms, and the public be respectful to all cultures when speaking publicly. I urge Michael Steele to carefully word a sincere apology to the Native American community, which could help stop such racist remarks from being made in the future," unquote. A look through a dictionary or even some knowledge of Native American history would show Mr. Steele that the term is considered a racial slur for many Native Americans. The Mille Band of Ojibwe will hold its 26th annual State of the Band event on Tuesday, January 12th at 10 a.m. The State of the Band address, titled "Courageous Leadership, Our Veterans, Active Military Personnel in Our Community," will highlight the band's priorities and initiatives for 2010 and its accomplishments in the past year. Mille Band Chief Executive Marge Anderson will deliver that address to band members, tribal government employees, state dignitaries, and tribal leaders. John Dunkley, the band's Commissioner of Administration, and Herb Weas, the band's Secretary-Treasurer, will also speak. IndianCountryTV.com will be live streaming the event in the featured digital channel at several forums, including IndianCountryNews.com and our NFIC Facebook account. So watch for our instructions about how you can watch that. A giant sculpture outside of Richmond's minor league ballpark is looking for a new home. The sculpture of an American Indian called Connecticut has been a part of the diamond since 1985 and served as a towering symbol of the Class AAA Richmond Braves. But with a new team called the Flying Squirrels coming to the city, the owner of the ballpark is looking for proposals to relocate the statue. The Richmond Metropolitan Authority said the sculpture doesn't quite properly represent the new team. The authority is seeking proposals on Connecticut's new home by January 29th. And in our continuing discussion on national health care, here is Kaiser fellow Mark Trahant with his latest update.
Mark Trahant, what can you tell us today about the national debate on health care? Where are we at with the whole thing?
Well, the national debate is coming to a conclusion one way or another. I think the odds are is that it's going to pass. They're now trying to make sure they have the votes and round up the exact number needed in both houses. It looks like it'll primarily be the Senate bill. Indian Country will come out, I think, pretty well out of this. It'll improve resources to Indian Health Service and open up some new avenues. That said, with my project, what I'm going to start focusing in on is how the Indian health system can reform, what we ought to do locally rather than nationally. And to start that off, on Monday, I have an interview with Dr. Rubidoux about the status of Indian Health Service reform.
Dr. Janice Rubidoux, the Director of Indian Health Service.
Yvette Rubidoux, right.
Or Yvette, excuse me, yeah. There's plenty of Rubidouxs out there. So you're going to D.C. and you're going to sit down and talk with her about what you've learned, or what's the nature of the discussions you think you're going to have with her?
Well, IHS has been conducting listening sessions and consultation with tribes about reform within IHS. So I'm very interested in what she has to say along those lines. I also have and will write about some ideas. I think one of the big challenges for Indian Health Service is what's the business model going forward. In theory, it's great to say Congress would fund IHS at the right level, but in practice, we know that's not going to happen. So what is required to make sure that Indian people don't get secondary care, second level of care? Also, what ways can IHS, without money, improve service to Indian people? One that I think is really easy is transparency. What if you knew before you went to the clinic how long the wait was going to be and whether it's something you needed to do? Is it really important to wait half a day, all day? Maybe it is. But that's the kind of thing where information could change the balance of the equation.
Well, not only is it what it is wasted productivity in a lot of communities. For someone like me to have to go to a clinic and sit there for several hours is a real waste of productive time. Do you see modern communication techniques like this conversation or Twitter or something like that playing a role in streamlining some of these issues, like sitting in the clinic lobby?
I think Twitter is a good example. What if there were a Twitter terminal right in the waiting room that had a hashtag with IHS Fort Hall and allowed people to comment in real time about the service they're getting or the wait they're having to experience? I think that's exactly the kind of thing that could be used.
The critique being a way for the clinic itself to evaluate rather than sitting down with a survey that says, did you like this experience? They simply tweet it.
Right, in real time. I think the way we grew up, most of us, is that criticism is something that's bad, that is hurtful, that makes you not want to do things. And I think in the 21st century, there needs to be a cultural shift, whereas critiques are good and that you learn from them and you want that sort of information because it's helpful. And that's a real cultural change, but one that could, I think, make the agency much better.
Indeed. You talked a little bit about the business model. Indian Health Service has, not been a business model. It's been a government-funded program. So when you say the business model, what kind of things do you envision in regards to IHS adjusting itself in that direction?
Well, I think it's stuff that we've talked about before, Paul. For example, if there's somebody who feels like they could contribute money for their service and they feel that they're wanting to, why isn't there a system for that to be to supplement what the government does spend? I think it's looking at what sort of health plans tribal governments have. It's looking at how to make sure the dial is fully turned up on Medicaid and Medicare and other government programs that are basically unlimited sources of money. If you are eligible for Medicare, the money is there. If you're eligible for the Indian Health Service, the money may or may not be there.
Is that a model that the community colleges have worked on? I've noticed that, for example, at the community college at Lac-Courte here, we have a lot of non-native students. It's become a choice for people in this county to be able to go to a community college before they go on somewhere. Is that something that might open the doors as well to other people in the community as a choice? An Indian Health Service clinic, which is open to anyone because it's funded by insurance and Medicaid as a service, a business model service, while local Native people are getting the services under their treaty rights.
I think that's a good conversation to have. I don't know the answer, but I think a lot of communities ought to wrestle with that question. If you're in a rural, isolated area, it really doesn't make sense to have two clinics. If you can have IHS be the rural clinic for both populations and have a way to pay for it so that the service is better for both, that might be in order. But that's a conversation the local community has to have. I don't think it's going to be one where there's a national answer.
Okay. You going to be able to give us an update after you get back from D.C. and let us know where things are going?
Or from D.C., either one.
Okay. Let's keep in touch. Thanks, Mark. Appreciate
Very good.
And that is the latest roundup of news from Indian Country on this edition of the Native News Update. We want to thank all of you for joining with us. Come back again soon. Miigwech.